Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand Building in Boca Raton. The number again is 561-409-4065.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, welcome to the Becky and Boca Show. I have with me tonight Dr. Janet Allenby, one of my favorite local cosmetic doctors, and she's actually going to do Botox on my face right here in the studio at the end of the show, so stay tuned. And I know a lot of you people out there get Botox, but maybe there's some that don't, that are curious about what it's like. It's really easy, especially with Dr. Janet.
Oh, thank you.
So, okay, tell us what you're up to. I know you have a lot going on now. You're not just in that one practice in Delray anymore.
Right. So we have Allenby Cosmetic Dermatology, which you've
That's your main
been
thing?
to. Yes.
Yeah, we had the big party with Teresa
Exactly.
Giudice.
That was amazing.
It's a beautiful facility there. You expanded about a year ago. And
yes. And with the expansions, we'll talk about that first because we've done this together, and this will be kind of a continuation of what's going on in
an update
in the aesthetic world. Because exactly, there's always an update, like every other day. I think I think and I say this every time. The more I'm falling apart, the more I'm like trying to find things that work.
Like about you.
I know.
You're like my contemporary. That's out there looking out for the next best thing so that you can help.
That's
me
why I can't stop practicing. Everyone's like, "Are you going to retire?" And I'm like, "No, I can't." Right? Exactly. Just for myself, I can't retire. Just to keep my face, my body together. So I think there's been a lot of advances in the last really year in my office, and it's just I think we're in a really an amazing time in aesthetics because everybody is really trying to find things that are, again, no downtime, no side effects.
People are looking good.
People are looking really good out
it's
there.
It's not like when our parents were our age.
When our parents were our age, there was maybe a facelift, and that was it.
That was your only.
Yeah, today there's a lot more fillers coming out. Yeah. The fillers are really much more advanced than they used to be. It's more, we don't have just one filler. So you can do things that are more flexible in the face, things that are more, meaning like when we're speaking, we look like we're actually talking, 5 years ago, maybe people looked a little too stiff, and everybody was blaming it on Botox.
You don't notice that anymore so much.
No, I mean, you do see crazy out there. And
some people go overboard.
Yeah,
we've talked about that.
Talking to you people out there that think that you should be filling for a mirror instead of a 3D version.
But see, all that comes around, like breast implants. Remember when they were doing basketball-sized breast implants? And now that's gone completely.
Way gone.
People figured out that that's not good.
Right.
So I think the huge lips and the huge cheeks, all that's probably over.
You and I understand that. And I will say, if you go to the mall, you're going to see a whole different, and I'm not for sure what's going on there. I still haven't quite figured out why.
I think it's the patient demanding it from the doctor, and the doctor just doing what
Crumbling,
the patient wants.
Exactly.
Because no doctor would do that and want the person walking around intentionally advertising their work.
Exactly. I don't think, I personally can't do it just because I'm afraid somebody's going to ask, who did yours? Exactly. And that scares me more than, and I should, it's when people do ask for that crazy stuff, it's like, I can't in good conscience do it to you. And I think that there are people, unfortunately, this is aesthetics is kind of one of those businesses where you do get a lot of people, they see money and they don't think of it as being an art, and that's really what it is.
And the more filler you put in the lips, the more money you make.
Exactly. Yeah. Exactly. And and it's sad. It's just sad. It's distorting the profession, and it's making.
And I think from the patient's point of view, the people that ask for that, I think it's like if some is good, more must be better.
Yes,
That's what they're thinking.
You got that right. You got that right.
So load me up.
Exactly. And I see, today I think what I'm trying to do in my practice more is, and I think we talked a little bit about it last time, is I use a lot of, probably one of the biggest things that I've changed is I use a lot more sutures or threads. People have heard the word thread lifting.
That's amazing.
Yes, and I will say that's probably my number one thing that I'm doing now, because
that can pretty much replace the lower facelift, right?
it can replace almost a whole facelift. But there's always a little bit of a but. And I think that the big issues with the threads is, I personally like the ones that have little fingers or barbs on them, that when you place them, they actually pull the tissue up and they hold the tissue up. Now, the other side to that coin, like I said before, there's always a good and a bad, is that these are pretty small sutures, meaning like the little barbs are not huge. You don't want them huge because they're going to pull funny and they're going to make the face lay funny.
So let's explain to people what this is exactly.
Yeah, okay.
Before we go
So
any further.
let's back it up and tell a little
It's
history.
called threading.
Yes, threading is what we're calling it. It's actually suture material, and there are different types. We all want to be using the absorbable sutures now, not the non-absorbable, because people are like, oh, I want it forever and ever. And you don't want anything forever and ever.
Stay in there.
Exactly, because things change and you don't want to have a problem. And if it's a bad thing, you're going to have it forever and ever. We don't want that.
Right.
So about 15 years ago, the sutures came out. They were more the non-absorbable type, and that's what kind of gave it a bad name 15 years ago. And the technique was much, much different. So that was like, oh, that was an awful procedure 15 years ago.
Okay.
Got reinvented, and actually the Koreans were the big ones in this one. So they really got on board with it, and they're the ones who actually make most of the threads today. South Korea is like one of the top aesthetic areas, so people should not be afraid of hearing if something is South Korean. It's very legitimate. China, maybe not. Okay. So then there are different types of threads, and the absorbable type, when they're put in, whichever type they are, they're going to dissolve over time, and they leave collagen behind, so they kind of actually fill the area.
And so they've pulled up. So once they absorb, everything is.
So what happens?
Pulled up and it stays that way?
Two types of threads. One is one you put it in and it just fills the space and lifts it, which is sometimes actually good for nasolabial, because what happens in these nasolabial lines that traditionally have always been filled with filler, the filler shifts over time, and it goes under the eye, and it starts closing the eyes down. So when you see somebody with their eyes getting squinty or smaller looking, it's usually that.
Oh, I didn't know that.
Right, and we can shrink it so we can treat it.
Okay.
But when you put a thread in, it actually stays.
Okay. Stays where you put it.
It stays where you put it. It's not going to migrate, which filler can. It's fluid. It's like it's like a liquid. The sutures that I love to use are really the ones with the barbs, and it's the ones that are going to pull the tissue. And when the tissue is resuspended up, you're getting a lift without filling. And in the past, we always fill faces to lift them, and that's where you got the bobbleheads coming around, right? And we learned, and we're like, okay, too much is too much, So we found out that if you lift, you don't have to use as much filler, because a lot of times, and I've said it to when we discussed this before, we age from the crown of our head down to our toes. So everything is aging, everything's losing volume, everything's reshaping.
South. Okay.
Yeah, so it's not just a good south, because what happens is not only we know we have fat that goes away, the muscle mass goes away. So your tissue's starting to have it's the texture is getting lax. So those combinations, it actually turns out even that muscles that have tendons attached to them that are attached to bone also pull on our skeleton, and they start eroding the skeleton. So that's why the skeleton starts changing shape.
Okay.
So when you see maybe somebody who went for a later facelift in their life, and they have this really weird jawline, it almost has disappeared, it's because you're redraping old skin over this structure that is not shaped in a nice 45-degree angle on the jawline, or in the eyes. Our eyes that used to be more forward
I think
actually
I've seen people like
rotate out. Exactly. And we kind of get fish-eyed over time. So you have to almost rebuild them to make it look more forward. And my mantra is always shape, 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 because shape is how we can tell someone's age, their health, their everything about them. And so when someone's looking soft and they have more of a shape that's more youthful, meaning more three-dimensional, sometimes you see when somebody gets filled, they have that flat look, and that's just weird, because nothing's flat. It's either going to go back, rotating out because the face rotates out, or there are just certain shapes our brain knows are okay.
Yeah.
Maybe this is old, but it's okay. But when you start putting weird shapes in, the brain goes, no, this is not right. Yeah. So that's we're not, the brain's just too quick. It's too fast. It does. We don't do it
really
consciously.
Think about it.
You just know. They look weird.
Looks strange.
Yeah,
we've all seen those.
Exactly.
people around. So
Unfortunately.
the threading, do you put the threads in? Where do you put them in?
Good question. Okay, so
I'm just curious how the procedure
probably a couple of years ago, it's and I can't speak for other people on how they do it. When I was taught again, when we reintroduced them to the practice, they come in and they teach you again how to do it. It was really a lot across the face, multiple threads that have the barbs that pull up.
So you're pulling up.
So you're
by
pulling
putting
up,
threads in.
but it turns out that, like, when you're crossing the face, there's a risk of showing a thread, and there's also a risk of puckering the face. There's a risk of actually growing in collagen there and puffing it up too much. So there's a lot of things that are going on when you're crossing the face. So I started migrating to outer face and just going straight up and under the jawline, straight underneath.
So you're not putting them in
so you don't
here, you're putting them
see them. So that was interesting. Then it was like, okay, these are awesome. I love them. I'm like, facelift coming.
I know, it's what you've done. Then they look great.
And so then I'm like, okay, they're not lasting long enough. They're going to last like about 3 months, and that's just not long enough. For the cost of them and the uncomfortableness of getting, which is actually much more comfortable, but still there's a little discomfort.
I never mind a little discomfort.
No, exactly. I know. It's. We've always known beauty is a little uncomfortable. Exactly. So then what I realized I think I was falling asleep one night, and I'm like, how do I get my threads to stay longer? Because I feel like I would have to put them in too frequent. And patients are saying the same thing to me. I realized, okay, my mantra is as far out as I can get. So I started using Sculptra in the scalp, and I've been doing that for years anyway. And I use it kind of to pad the area. It numbs the area when I'm working. And then I use threads from the scalp into the face, and it gives an entire facelift look. Ooh. And I can use like 4 threads with like a 1 vial of Sculptra to get like a facelift.
Well, let me ask you, is it instantaneous?
Oh, yeah.
As soon as you do it?
Oh, yeah.
Oh, that's pretty nice.
And it lifts all the way into the neck.
It lifts the neck too?
Yes. So everything lifts up, and you're like, whoa, what just happened? I mean, it's like astonishing. Before, it was a little harder to capture on the camera. Now we can actually capture it very easily because it changes. Even the eyes look better. Everything
because
just
it
lifts.
Would lift the eyes too.
Everything.
And I know that's important because everything turns down.
Everything, and we don't want down because down looks sad or it looks angry.
Yeah.
Those are the things that we associate
Tired.
with down. Exactly. And it's just, I will say it's not uncomfortable so much doing it anymore. It's a little uncomfortable afterwards because it's a tight space, so it swells a little for a couple days, and you feel it. You're like, I feel that up there, and it's like, I'm a little tender. Don't rub my head. You can wash. You can do everything, but it's just
so
you're a little
really
more sore.
No downtime. There's just a little discomfort afterwards.
Exactly.
Okay.
It's more just it's uncomfortable.
We can live with that.
I know, right? It's like that's an easy one.
Yeah.
You're gonna look good. You'll forget the pain. You know.
Absolutely.
So I have been doing a lot of that, and it's just that's a game changer. It really became
interesting.
Yeah, it's almost like a
People, listen
facelift
to
now.
this.
Yeah.
Okay, so it can give you pretty much the same results as a facelift.
Yes, and
it's just an in-office procedure.
It's probably a 15-minute procedure.
Oh my goodness.
Know it really is crazy. It's such a simple one, and again, it's just we've kind of got it down. Just
now the longevity of it. You were just talking.
So with longevity with this, because you're using Sculptra with them, it kind of holds the threads in place better. That's why
because the Sculptra builds collagen over time.
Exactly, and this is also building collagen. So you're kind of combining similar products that are. It's like kind of a scaffolding for it, and then it holds it.
Okay,
but you get the immediate response, and then you get also the collagen building around it, which holds it in place better.
Okay.
So So
how often would someone have to come in?
Probably, if it's my age group plus, I would say you probably need to be coming in.
We don't
anyway.
even know what your age group is, Janet.
Exactly. If you've been in practice more than 25 years, exactly. I think most people should be coming in at least half a year. That would be the normal. They may not need those. They may be doing something else anyway. Usually I'll do that, and I don't have to use hardly anything
and wait and see how
the rest of the face, right? Yeah. And then probably on average, if that's the only thing you're doing, it's probably about 9 months, which is how long Sculptra really is going to be nice for if you're just using 1 vial. And that's all I use is 1 vial for that, where traditionally in the past I would use more Sculptra.
If you're using just the Sculptra.
Exactly. But that would get a puffier look,
Okay, so coming in every 6 months for a 15-minute procedure to
Not
get
bad.
the effects of a facelift sounds pretty good to me.
Right, it's not bad at all. So that's kind of been the biggest thing, and I would have to say I would say about 90% of my patients are having that done now, and it is. I mean, it's really just a very simple way of getting a huge effect. Mm-hmm. Yeah,
without surgery.
Without surgery. So
that's amazing.
Yeah, that one has been pretty good. There is a new toxin out, and I'd hate to say the word toxin because
you're talking about Botox.
Yes. Okay. So there's a new Botox
we use
type.
Botox as a noun, but it's really
right. It's a brand.
Too.
It's a brand. It's a brand.
We're using it as a
noun.
noun.
And Allergan doesn't like it when you're using it as a.
Well, I think it's pretty cool. They coined an actual. It's probably in the dictionary now.
It probably is. You know what? I should look that up. I never even thought of that one. So there is a new. We call it a toxin in our world, just because there's actually 4. There is Botox. There's Dysport. There's Xeomin, and now there's one called Jeuveau,
and they're all under the catchphrase of Botox. That's
exactly. Well, that's what we call it, but yeah, you have a lot of fights with the companies,
right?
I think that one has actually been very nice. I have to say, I've been using it for a couple months, and
what's the difference between that and the others?
Not a lot, honestly. I'm not seeing a big difference. I think that it might kick in a little quicker, like Dysport, but it kind of has a little more of a look of Botox, if that makes any sense, because these are very subtle changes, and
probably only someone like you would notice.
Probably, as far as the notice, but I would say, there's a subset of population that are immune to Botox now. There are antibodies that
because they've used it.
They've used Botox for a fair amount of time, or they have a very robust immune system.
So maybe it's good to switch it up.
It is. So your immune system starts eventually growing antibodies, and you end up becoming immune to it, which is like, that's kind of scary. Mm-hmm. So, and you can also have it with any of them. So the one that you're not supposed to have it really up for is Xeomin, but Xeomin doesn't seem to really last that long. It's not one I primarily will ever use only if it's kind of like nothing else works and they really need it. So it is a very good contender, and it's kind of it's good to have a little more competition in that space. That way it might bring the prices down a little bit.
Yeah, it would be nice if the prices come down.
It would be. It definitely would be. And the unfortunate part is all the companies are still positioning it to the doctors about the same price, and it just kind of...
it's like a cartel.
It is. It's called price fixing, I think, but that's another discussion altogether.
Right. I guess since it's an elective thing, there's not much we can do about it.
I mean, we could charge nothing, but we would make no money, and it's kind
of... you have to pay for the product.
Right. We got to do and that goes to always back. If you're really paying very little for your toxin, Botox, whatever, Dysport, it's because you're not getting much, and so it's not the fault of this.
It's very confusing when people put pricing for Botox out there because they price it in units. Like you'll see an ad for 10 units, but you might need 20,
right? 30. Or the unscrupulous practice may say what people want to hear. You don't know what you're getting. If you're paying a very small fee, you're not getting much, and don't expect a lot, and that's okay because you're not paying a lot. It typically, for most places,
so they're not lying.
They're not. They
can give you that amount for that price, but
right. You just it's just you have to know what you're getting into. So you're not going to have everything treated if you're paying a very little amount. In average, it's usually over $500 at least to do an upper face. If you're going to use the neck, it might be the same price because necks actually take a lot, but they're fantastic. So everybody's.
I know, I've seen it. Yeah. What do they call it?
Necklace. Yeah, Nefertiti necklace. Yes. They actually, it is one of my favorites. Also, I think
that's amazing.
Yeah, that one is.
You can lift your whole neck with Botox. It has to be positioned properly because you're pulling in the opposite direction, right?
Well, you're really trying to relax the platysma muscle, which is like a sheet across there. The best thing with the neck is really with the bands. If you have a lot of banding, meaning those bands sticking out, it's the tendons that you're seeing. You can relax those, and I think that the neck is where we see the age.
Everybody complains to me about their neck.
Everybody. Every age group has their own complaints. The young ones, it's the lips. The
you get
middle,
to a certain point where neck.
Yeah. From like 45 on, it's the neck because everything lands there, and there's the laxity. Yep. Exactly. And if you don't have that nice 45-degree angle there, it's obvious. So, it's funny how all these things kind of like have their own little place, which is normal. It just makes sense. Other things in the office, actually, one of the cool things, and I brought you a little bit, is Skin Aid. Yeah, it's kind of neat. This one has really done well. Okay. This is a drink that you drink.
Yes.
Yeah.
Okay, they were telling me about this at the Beauty Lounge.
Oh, it's wonderful. I actually kind of am addicted to the taste of it.
Okay.
It
You drink it, and what does it do?
Okay, so it's basically vitamins and marine collagen. So it's for those vegans out there, it's a marine collagen that is like 7,000 milligrams of collagen. Now, it's not absorbed in the stomach. It's actually absorbed through the mouth, the collagen. If you drink collagen or you took those tablets, you have to take about 20 times more to get the same as what you get in one of these drinks.
Okay.
You take it every day, at least for about 90 days, and you will see collagen growth. Like I've had a lot of people who have severe dry issues, and their skin starts getting softer. It helps your collagen grow.
Okay.
Now, the reason I said, I'm like, this is hokey.
I know you try everything out.
Yeah.
So
and I'm going to
tell me it was good. I'm like,
I don't trust always the pictures as far as the skin because, somebody's going to Photoshop something. Yeah. And I'm always kind of like skeptical on that until somebody shows me science. So they did histology, which for those people who don't know what histology is, it's actually sections of tissue that they stain special so they can see before and after whether something grows collagen or not. And actually in their studies and the brochure that they have that I gave you, it actually does show collagen growth after 90 days, which is, it's like at least about 45 to 50% more collagen in the skin.
Wow, and just from a drink? You drink
just from a drink, yeah. And the drink, it's not just collagen, it actually has a lot of vitamins in it too. So for those people that take a lot of vitamins, you can actually eliminate the other ones and just take this, and that's your one thing for the day. So, and it's kind of, it reminds me a little bit, the smell, and some people like the taste, some people don't. I would say most people do, but it kind of reminds me, like I do like IV therapy. I just hate getting poked, and I don't have time to sit there for 45 minutes. I'm like, forget it. This, you just swig it down and you're done. But it smells kind of similar to me. That's kind of, when you smell it, if you've ever done it, like, oh, yeah.
All right, we're going to go to break now because you're going to do my Botox.
All right.
We just have to change positions here.
Yep.
So we will be right back. Stay tuned. You're going to watch me get Botox by Dr. Janet Allenby.
Sponsored program.
Cool.
Its staff, management, or sponsors.
It's the Becky and Boca Show. You've been listening to and watching The Becky and Boca Show. Ivy Lee's Luxe Makeup and Beauty Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand building in Boca Raton. The number again is 561-409-4065. And now, back to the show. All right, we're getting ready for my Botox.
Okay, so actually one of the new things that we've been using in the office is something called a vein finder. It's actually
We got to make sure you can hear me on this mic.
All right, for those who can hear me, and I don't know if you can see this, let me see.
We're on radio too, so we have to describe it.
Okay, so I have this device. Yeah, let me see, maybe your hand.
I got big veins there.
Yeah, I don't know if
can't see it on.
You can't really see it, but maybe in the wrist. It's pretty cool. Let me see if we can show everybody out there.
Okay.
This is a vein finder, and this is huge in helping to not bruise people, and not only that. When you hit a vein, it hurts. Not just only bruising, but it's a really uncomfortable feeling.
Okay.
So normally my nurses will hold this. So I'm going to kind of just glance through where my distribution would be with you to make sure that I'm not going to hit a vein or anything. So when we look at you, and actually I think we can see it here. You can really see the reflection more from the camera, but I am looking just to basically see where the veins are, which is probably more important around the eyes because that's where most people end up with a little bruise there.
Okay.
But you can see a pretty big one right down the middle, which we're not going to hit.
Okay.
Now I'm going to just check your eyes real quick. Not too much there. You actually are not super veiny, which is nice. Most people are quite veiny.
Okay.
Let's see here. Let me get a little alcohol. I have my gauze here. I'm fine.
Okay.
So I am going to just get a little wipe of alcohol. So this is simple. So people.
This is the number 11 that people don't like
So
in between
we're
the eyes.
going to treat this. These are called the 11s here. Make a frown for us. So she doesn't have a real strong frowner, but it's a very negative look when we do have very strong frowners. But they're coming from the muscles right here. These are called corrugators, and this is called the procerus. This muscle actually lifts this part.
Okay.
These muscles are the ones that cause the crinkling here. The frontalis are the muscles up here in the forehead that lift, and then we have the orbis coloris oculi, which is a circle here. So sometimes we'll hit here, sometimes we hit under the eyes, sometimes we hit the nose, because sometimes there's some, we call them bunny lines. Raise your nose up, let's see if you have them. She's not bad, but she has a couple little bunny lines here, and it's an extension off of the muscle. So your lines will always be perpendicular off of where they're moving.
Okay.
So like eyes, they're going to go off. The muscle is circular, and they'll go perpendicular. So here we go. This is a pretty simple one. I think Becky's done a little Botox in her life, so she kind of knows what to expect, and we're going to give her a little baby pinch. If you kind of pinch the tissue up, it hurts a little bit less, and you just do this. And
I didn't even feel that, Janet.
Yay.
You sure you did anything?
Exactly, right. Sometimes it stings just a little. I do, again, like to pinch a little before I insert the needle. It does hurt a little bit less. If somebody's really strong here, and Becky is absolutely not, she is a petite little thing here. Sometimes I have to put a little bit extra in these, but then you have a little more risk of the drop.
Yeah.
I can correct if somebody has problems, where I can correct if their eyebrows are high or if they're like one's a little higher than the other. But the bad is you don't want to have somebody with the eyebrows sliding down.
Yeah.
And sometimes that's actually because, and I'm like doing a little pinch, I'm kind of going into it's called medial frontalis area. Sometimes there's crossover of fibers right here. I'm going to get just a drop here. And the only reason I do here is because sometimes the fibers cross over. She is a sport here.
You hear that little crunch sound? I like that sound.
Yeah, everybody's like, oh, I love the crunch.
Yeah.
I know you're really in there.
Yeah.
All right, so she is doing fantastic. She isn't super vascular, so we're not really worried. So it shouldn't hurt too much here.
No, I honestly haven't felt anything.
Good. And I'm just kind of dotting her with a little bit of the alcohol just to kind of clean up the area, because we don't want to have anything injected that we shouldn't have in there. All right, so we're just putting couple units in each spot. In the frontalis, we don't want to be super heavy-handed. That's the one that tends to create a little more problem with the dropping that I was talking about that nobody really wants. So this is pretty simple. I can see a vessel. You know, when I kind of looked with the vein finder a second ago, she's not super strong with the vessels. I will tell you, these little guys here, they sting a little, so usually it burns just a little going in. So she's actually being super, but
No, I don't feel anything.
It's so tolerable. She is doing fantastic. Like, I just had my hair done. Don't mess it up.
Okay, we're
Usually
we got a couple of minutes left here,
Okay.
but I don't want to rush you. We can go after. We can go after the show.
Exactly. She's like, we can finish after. Don't worry. There we go. Get a little down here. I like to get it pretty hard here.
Yeah. Okay.
All right. Well,
we can keep going after we go off air if we have to.
Yeah, exactly. All right. All right.
Bye. See you next week.
Bye, guys.
You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.